sort of my first love. I've been a person who's had a long-standing love affair with the brain and the central nervous system for most of my adult life. It was because of my grandfather. He had a stroke when I was an early teenager, and I saw what happened to him. I saw what happened to his brain. I spent time with the doctors who cared for him.
The very first patient that we were about to treat had metastasis. Her bones were littered with holes. And it didn't seem even likely that it could work. But when we purified blood-forming stem cells, we depleted the breast cancer cells 245,000-fold. 16 years later, she's alive without disease. Please sit down.
Thank you.
There's no doubt that you were cured.
It's amazing.
One of the first patients that I treated with this T-cell therapy was a 10-year-old boy. I walked into the room and he spoke to me in my mother tongue, my Bengali. It totally took me by surprise. There is nothing more gratifying to a physician-scientist than being able to communicate and also treat and hopefully cure a patient.
I get to take care of patients who have brain tumors, spinal cord abnormalities, trauma. We've never met them, and all of a sudden we've gone from being total strangers to the most important person in their life. And it's something that you have to really think about.
Patients are central to what inspires me.
It's like they're your friends. You haven't seen them for a long time, but you're emotional.
One of the most exciting things that we're doing now is donor stem cells in a bone marrow transplant so that we can treat their cancer, AML, acute myelogenous leukemia. It's a very radical trial. No one's really done this kind of genetic manipulation in stem cells before.
There are transformative things happening in medicine, in public health, and science that aren't yet translated for the lay public.
This is just an ongoing situation. And
as a journalist, being that bridge, for 20 years now, I've been privileged to be able to tell those stories. I'm all in. I'm still here. I mean, that was very inspiring to me.
I like to think about my books as my personal stethoscopes to feel the pulse of what's happening next. And I'm absolutely thrilled that they can communicate very complex science to the public at large.
If you're a person who made a discovery, you're the only person who legitimately could ask the question, what can we do with this to help people? I started on a line to ask, can we isolate from human bone marrow the blood-forming stem cells? That led us eventually to show only blood-forming stem cells can divide and give rise to an exact replica of itself. Within 4 years of that discovery, we were treating women who had widespread metastatic breast cancer.
I think I was just saying to David, it's so fascinating. The idea that you could have a stem cell foundation doing this kind of research wasn't something that I was accustomed to seeing. People were busy here growing this foundation, growing the lab and propagating science forward.
So we have collaborations with all.
I started a formal collaboration with Laura Andres Martin at JAX-NYSCF. Laura and her team quickly built one of the largest banks in the world of ovarian cancer cells grown in organoid form. And the idea is to understand how do these cells keep growing. All of this work that we've been doing in the past decade translates into medicines. They're already emerging.
We make discoveries in my lab because I'm lucky enough to have very bright people who have within them the possibility of creativity. You got to get people who have the ability to think and give them enough freedom. Susan Solomon has done that at JAX-NYSCF.
Well, I'm so honored to be recognized. I'm looking forward to sharing a prize with Irv, thinking about the times when I was an undergraduate washing dishes in a lab just above him.
We had 100 microliters of a clear fluid. And this is amongst the crowning recognitions for me, because I know that I was chosen for what really happened, not for my political position, not for doing things in the way that people usually do it.
Like if you're looking at something like Alzheimer's, how do you approach that? I mean, I care deeply about this sort of work. I do feel like in my lifetime, hopefully, certainly my kids' lifetime, there will be some things that we look back and say, that was a huge, huge move forward. I will keep telling the story, and this will be one of the most important stories I think I tell.